Hey, I'm Billy Umansky, the Lawman, and today I'm really excited because I'm talking to a friend of mine, Dr. Ruben Rivera, who's a pain management doctor. Hey, Doc.
Hi, nice to have you here today. Today we're going to be talking about going through some of the EMG or nerve conduction study that we have available.
That's awesome, because I'm very curious. A lot of our clients who get into car accidents they don't know what a nerve conduction study is or an EMG. First of all, is that the same thing?
They both are under what it's called electrodiagnostic study, so it's two part of the same study, all right? So essentially, the nerve conduction study, what we do is we use a device that comes with this machine in which we stimulate different nerves of the hand or the lower extremity to see how fast and how strong the electrical signals go through those nerves. Then the other part, which is called the EMG, we use a small needle which has some of the muscles either in the upper lower extremity or some muscles of the back to see what's the electrical activity of that muscle. So that tells us if the signal is getting straight from the nerve or into the muscle, or if there's disconnection between those two. Right?
What can a patient or my clients expect when they first come into the examining room and you're about to do a nerve conduction study on them? Take us through, from the patient's point of view, what they can expect.
Yeah, so exactly. So right when they come into the room, we're gonna do some measurements that we measure the length of the nerves from where we're gonna be stimulating to where we're gonna be taking the signal. So essentially, it's not painful. It's something that is just a small electrical sensation, and then we prepare the area and we do a small stimulation. It can be either in the upper extremity, like in the hand, in the forearm, and also in the leg of the nerves going into the foot.
So I'm seeing that this table is in the upright position. Are they in the upright position when you're doing the nerve conduction study?
Yes, most commonly when we're doing the upper extremity, the patient can be sitting here comfortable to do those testings. Now when we're doing the lower extremity, it's easier for the patient and for us to have them lay down in a supine position so that we can go ahead and stimulate the nerves of the lower extremity. It's just easier and more comfortable.
Let's explain, what is an upper extremity?
Okay, so when we're talking about upper extremity, we're talking about essentially the hands and the forearms. Usually what we see with these injuries, especially in the neck and the upper extremity, like the hand, elbow injuries, we can see that sometimes some of these nerves in those areas get affected. And that's where the testing is based on. These nerves that start in the level of the neck and go down into the arm. So injury in any of those areas, we can use this test to try to specifically point to where exactly is the injury.
So you had taken this out before. What is this exactly called?
Okay, so this is called the stimulator. It has these two pieces. This is what we use to point it towards the nerve, and it has a button that when we press it, it stimulates. When we press it, it will send an electrical signal directly into the nerve. The nerve will get activated, and that's how we can measure how fast it travels into the hand or into the foot.
Let's talk about the EMG part. Do patients come in and just do the nerve conduction without the EMG, or are they always going for both?
Yeah, actually we're going for both when we're doing these tests. Essentially the part of the EMG, we use a lot of the information that we already got from the nerve conduction study, because the nerve conduction study essentially help us doing a map of which nerve are already affected, and each nerve goes to a particular muscle. So when we're selecting which muscles we're gonna test in the EMG, that's why we always do both of them.
Tell us, like EMG, what does that stand for example?
Okay, so EMG stands for electromyographical study. So electro from the electricity that goes into the muscle to activate the muscle, and myography is essentially the muscle, right? So what we do is the needle and the tip of it has an electrode which measures the electrical activity of the muscle. So that way we can see if there's any abnormality in the signal that goes into the muscle.
So let's talk about the needle. Do you have an example of the needle that we could take a look at?
Yeah, so I have one right here. Let me just open it up for you so we can see it. So this essentially is the needle. It comes, we connect it into the machine, right? So the needle is a very thin needle, very small. We don't have to put the entire needle into the muscle. Just the tip into the muscle will do. And I don't know if you're able to see it, but right at the tip, it has like a shiny area over there. That's the electrode. And this gets connected into the machine, and that transmits the electrical signal into the machine.
This machine?
Yeah, this machine right here. It comes with a software that allows us to calculate the velocity of the signals that go from the nerve into the muscle. So that's what helps us to determine if there's an injury or if there has been recovery from an injury.
So why does someone come to you for a nerve conduction study, and along with that, who would refer you? What type of doctor would refer you for examination or diagnosis using a nerve conduction study?
Okay. So the most common things to refer for this study are injuries in the nerves of the legs or the arms. Most commonly, evaluation for carpal tunnel syndrome, for example, injuries to the nerves in the area of the neck or the lower back. Also, for example, orthopedic surgeons, they refer us a lot of patients to assess or evaluate after a fracture or after surgery to see if there has been any damage to any nerves in the legs or the arms. Neurologists will also send us patients for those evaluations. But most of the referrals, we get them from the primary care physicians because not only because of injuries, but also patients that might have neuropathy, peripheral neuropathy because of diabetes or any other conditions. They also refer us patients for those evaluations to see if there's any nerve damage.
I appreciate you speaking to us about the nerve conduction study test and the EMG, and I really appreciate it because I think our clients can have a good information and education about these procedures. So I appreciate it. Thank you very much, Doctor.